Patients that have abdominal aortic aneurysms are monitored for symptoms and also for growth of aneurysms. The reason we do this is because of the risk of rupture and death from rupture. Once an aneurysm is identified and it is found to be over 5 centimeters in a woman or 5.5 centimeters in a man, then they are offered repair of their aneurysm. There are 2 different ways that you can repair an aneurysm. For many years, we did an open abdominal repair where you had a large incision and you would spend over a week in the hospital, and it would take 6 weeks to recover from the open operation. In 1991, we started to perform EVARs in this country. EVARs stands for endovascular aneurysm repair. So there are patients that are seen in the clinic for surveillance of aortic aneurysms, and they will frequently have an abdominal ultrasound to evaluate the size of their aneurysm. When we are considering an operative repair, then we would get a CT scan to look at the aneurysm in more detail, and then that will give us a blueprint of how to repair the aneurysm. There are patients that will come in through the emergency department that are symptomatic with abdominal pain or back pain, and in that case, if they come through the emergency department, we would obtain a CT scan to help us plan their operation, and some patients are taken directly from the emergency department or even from the helicopter directly to the operating room for an emergency repair.